Good morning. I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. I'm very pleased to have author and chairman of Serigraph, John Torinus, here. Good morning, John. How are you?
Mabel, how are you?
Well, you've had a lot of people wanting to hear what you have to say about the fiscal reality of healthcare. Give me some of your points.
Well, the fiscal reality is pretty grim. Budgets are busted at every level of American society. You know about the deficits at the federal level, largely driven by health costs. State governments are awash in red ink, largely the culprit being health costs and benefits. Local governments and school districts are laying people off. Corporations have either gone, I had Chrysler, General Motors, Visteon, and Delphi as customers. They all went bankrupt, largely because of benefits. And health costs are the #1 cause of personal bankruptcy in the United States at this point. So the Hippocratic Oath for the medical world is first do no harm, and they mean that in medical terms. They ought to apply it to the economic side of the equation as well. Do no harm economically, and they're doing a lot of harm.
Well, people seem to be well aware of the huge costs that this area is creating, but it would seem like we're on the road to trying to find solutions here. Are we on the right track?
Well, the guys inside the Beltway think the right track is a federal law with mandates from atop and insurance reform. If you're out across the land, across the country, you'll notice that private corporations and their employees are starting to engage this issue. And so if there's any hope for fixing it and getting the cost side of it fixed and the health side of it fixed, it's going to come from private corporations and the executives and the employees in those corporations.
And what needs to be done exactly by them?
There are a number of platforms that have evolved from the innovators in this field, and they're being tried out pragmatically in corporations to see what works. Of course, the federal law is the antithesis of pragmatism. It was devised by conceptual wonks inside the Beltway. It wasn't tried, it wasn't tested. We'll find out how it works over the next couple of 3 years. Early returns are not good. They just defaulted on, part of it was supposed to be an easy insurance policy, an affordable insurance policy for small business. That was supposed to go into effect July 1st, 2014. They just punted it back a year. So early returns are not good on the top-down approach to fixing this thing. The bottom-up approach, corporation, company by company, employee by employee across the country, the early returns are excellent. So some companies have managed to, in one word, flatline their costs. That's not a good word medically, but it's a very good word economically. So some companies, a lot of companies now, have got their costs under control, and the only way they can get there is by keeping their people healthy.
Well, you wrote a book that's called The Company That Fixed Healthcare. Where did that come from, and what are you referring to?
The title
fixed what?
So about 10 years ago, I decided that we just couldn't stand the pain of hyperinflation in health costs in my company and survive and be competitive. So I personally got involved in the health costs, the healthcare issue. And we made it a strategic imperative inside of Serigraph. One of our major things is we have to get this thing under control. And a couple of years in, I'm a slow learner, I figured out, I'll never get the health costs under control if I don't get employee health under control.
Okay.
And we all know that we have an epidemic of obesity. We all know that only a third of the diabetics follow their regimens. So, but if you apply management theory, management disciplines, and management energy to these issues, they can be managed just like anything else can be managed.
Well, how did you get your employees at Serigraph on the road to being more healthy?
Well, first you stand up and you got to be a leader, and you say, hey, troops, hey, people, this isn't working. It's killing us. I need your help. Help me manage this thing. We do that in every other sector of our business, so I just said, help me manage the health costs.
And they responded by doing what?
And then the second thing you do, you got to get the incentives and disincentives aligned. So you put in what they call a consumer-driven health plan, and that's a high deductible offset by a health savings account. So if you're working for me, you have a $1,500 deductible, and your family has a $3,000 account. We put the money in your account every year. And so then when you go to purchase health care, you're not just buying it blindly, you're not buying it without any impact. You're thinking, gee, If I call an ambulance to go to the hospital, it's going to cost $1,500. Maybe my husband could drive me.
Okay.
And people are making those intelligent utilization decisions day in, day out, because you have the incentives and disincentives aligned right. There was a famous economist who said, "It's the incentives, stupid."
Okay.
So we're putting the incentives and disincentives in place.
Well, what about day-to-day activity at the company? Did that change at all by actually getting people to change some of their unhealthy behaviors and revert to more healthy behaviors?
There are a number of platforms that you have to put into place. You can't do any one single thing and change the health direction of your company. You have to do a number of things. So for instance, so you get the incentives and disincentives. The next thing you can do is put in an on-site health clinic. So we have our own doctor on site, we have our own nurse on site, a dietitian on site, and it's right there, it's convenient, and so we're emphasizing primary care. And the first thing you do is do a health risk assessment, and you'll find out immediately that you got a couple of diabetics that are at high risk. You immediately start helping them, coaching them, and get it fixed. And then you do an annual. So we know, for instance, we've dropped our cholesterol from 207 average down to 193. Our people are getting healthier. Ergo, our costs are staying flat. So there's a lot of things you can do, but essentially you have to create a culture where people care about their health and they help you manage the health costs.
Okay.
They're intelligent adults. They manage every other part of their life. They buy cars, they buy insurance policies, they buy education for their kids, they buy mortgages. They're intelligent people. So if you say, help me manage the health costs, and you give them the tools to do it and the incentives to do it, they'll do it.
All right. John, any other message you want to leave our viewers today?
Well, it's not only a strategic imperative, it's a patriotic imperative. We got to get this thing fixed across the country, and I know of no better place to start the fix than in private corporations.
All right. Well said. Thanks, John. And I'm Mabel Jong. Thanks for watching.